Teaching Hospital. Now, this morning he's going to tell us about the role that he plays in the hospital, the contributions that have come in from individuals and organizations, which have also helped to support the actual running of the hospital as well. So let me go no further and introduce Dr. Akis Afoku, and he's with us this morning. Good morning, Doc.
Thank you.
How are you?
I'm good, thank you.
Great. Doc, tell us a little bit about the history of Tamale Teaching Hospital.
Yeah, well, Tamale Teaching Hospital was established somewhere around the late 1990s to help with the training of medical students from the School of Medical Sciences of the University for Development Studies.
Right.
But otherwise, the hospital had been established about 40 years ago by the SYL Champong regime, and it was the regional hospital, Northern Regional Hospital.
Right.
So until it became the teaching hospital.
Teaching hospital,
yeah.
Okay. And I've listed some of your roles there: Director of Medical Affairs, Coordinator of Mobile Clinic Services, but there are a lot more. Kindly expand for us.
Yeah, I'm actually the consultant urologist at the Tamale Teaching Hospital.
Wow.
And also a senior lecturer at the medical school.
Okay.
Coordinator of clinical studies.
Wow, so you have numerous roles there. Congratulations. Well done to you.
Thank you.
Now, in general, give us an overview of how the hospital is doing at the moment.
Yeah, well, the hospital is doing quite well, considering that we have a big catchment area, the Northern Volta, Northern Brong-Ahafo, Upper East, Upper West, and Northern regions, and also from the Sahel region. And as you can see from my own roles in the hospital, there are few of us, and we have to do a lot of things at the same time.
Right.
Yeah, so if you consider that, I can say we're not doing badly. We do have challenges, though, but on the whole, we are able to do our academic work, research work, that is. We also do teaching and also give service to the community.
Okay. Is NHIS effectively working in your hospital?
Yeah, there are challenges with the NHIS. Firstly, it has to do with the fact that we don't get timely payments, but this is a countrywide problem.
Right.
And it's not only limited to Tamale Teaching Hospital.
Correct.
However, the problem there is that about 95% of our clients are NHIS, sponsored clients, and if the payments don't come in time, we have a challenge in getting resources to run the hospital.
Okay.
But otherwise,
and 95%, that must put a large strain on a lot of the resources that you have.
Yes, so indeed, and considering that our catchment population is huge, we have a lot of strain on the resources, on our machines, and also running costs, reimbursing all these costs that we incur. Yeah.
Okay. It's been known that you get financial assistance from individuals. Tell me how that's been going.
Yeah, we have a lot of, let's say, charities and NGOs, both at home and abroad.
Okay.
Notable among them, Action Aid. We also have Jacob's Well. We have the sister city of Louisville in the United States, offering some help with teaching and treating of patients and medical consumables. Then we do have local organizations like the Bank Stanbic Bank, and other local organizations that help us with our outreach.
Okay.
One of the core things we do in Tamale Teaching Hospital is to do rural outreach with our mobile vans.
Right.
If time permits, I can later, talk about this in detail, because these mobile vans are equipped, as a moving hospital.
Right.
So if we stop in any community, we can offer ultrasound, X-rays, laboratory, and we do diagnosis and treatment and referral.
Is this the mobile clinic services that we're talking about?
Yes, the mobile clinic services. And what is important is that the mobile clinic services are free of charge.
Right.
Once we travel 200 kilometers from Tamale to a community, then whatever we are offering them, we can't expect them to pay.
Yeah.
Because if one child there is unable to pay or indeed has no health insurance, we're going to leave him behind, and he may be the most sick.
Right.
So we try to get things going, and we've had some support from the local and international organizations.
Okay. Now, with such challenges happening in the hospital, obviously people who work there, nurses, medical staff, must have some frustrations, which also may manifest in their bedside manner and the way they treat patients. Does your administration have enough bite to be able to deal with these people who are, not necessarily treating the patients well?
Yes, I think that we do have, but I should say that we have a kind of supportive, role, because we do quality assurance surveys, and this directly impacts, and indeed, patients are allowed to complain directly to the administration about specific cases, and we do investigate them, and we meet our treatment. Indeed, when some people misconducted themselves and needed even to be dismissed, we ensure that they lost their license to practice as a nurse or other category. But we are talking about the challenges that may lead to frustrations. One of our biggest challenges is finding accommodation for the staff. You need key staff, and everywhere else they are giving them good conditions. One of the basic that we would have wanted to do is to at least provide accommodation that can attract people up north, to serve. And indeed, the hospital spends close to 2 million Ghana cedis yearly on accommodation alone. Okay. And this is not even enough for a quarter of the people who require or whose working conditions demand that they should be given accommodation. So these are areas that we have challenges in. But that notwithstanding, professional standards should not be lowered because of individual problems. And in order to safeguard the patients and their rights, we need to act swiftly at all times, remembering that any of us can be a patient and should be respected. And
Okay. Now, within that region, do you have issues with people, tradition, spirituality, religion versus medicine?
Yes, there are these issues always coming up, and as a professional, it's important to understand that people have the right to have their beliefs. Yes. So if the person thinks that a boil in his shoulder is painful and he needs medicine for it, but he also needs prayers, you have to do all you can to give him the medicine. We need to act, all of us, doctors and other health professionals, like the vulcanizer. You have a puncture, you come to him. He has to mend your puncture rather than delve into why you drove through thorns and So we have these challenges, but unfortunately, some of the herbs and other treatment methods may sometimes cause severe damage. Kidney failure is one of them. And it's difficult to recover from these kind of problems. And indeed, we do have a weekly education program on 3 or 4 radio stations in Tamale, just educating people on these issues. Otherwise, they come with late-stage disease, which is always unfortunate. Okay.
Now, we've mentioned a few of the challenges, such as shortage of resources, i.e. drugs. But tell us a bit more about security around the hospital, and also obviously the environment in Tamale is a lot different to us down at the southern part of the country. So how is it in regards to things like energy, air conditioning, heat?
So basically, let's look at the issue of security. Indeed, the most vulnerable are patients. A patient is lying there already weak and not able to do things for himself. So we need to provide a very secure environment. In this regard, actually, the hospital management managed to put a fence wall around a territory that is well over 200 acres of land.
Wow.
And indeed, we also have some security men, and we give them constant training just to make sure that patients are safe. So that has to do with the security. Concerning the general environment, especially around this time of the year, it's quite hot up north, and we have a lot of systems like our MRI, the CT scans. They all need to work in a cool environment, and it takes a lot of power. So what the Tamale Teaching Hospital management and board did was to try and secure a direct power supply from the main grid.
Okay.
So if Tamale goes dark, the hospital has
hospital's
power.
still power.
You know, because we have these machines that are also sensitive to fluctuations in current.
Yes.
You know, once there's a fluctuation, it shuts down, and when that repeats, it breaks down, and you know, $3 million will be blown just because of power fluctuation,
as well as people's lives.
Yeah, and indeed.
Yeah.
And they would then have to rely on, you know, coming to Accra and elsewhere to do some basic tests. So because of that, we took, you know, some steps to secure electricity. We don't really have doomsaw, I should say.
I was actually there last week, and I can say that you don't. I didn't witness it while I was there at all. All right, so Dr. Afoku, at this point in time, obviously you have a national platform here in front of you. I know there's a lot of people who have been contributing and helping you, but obviously a lot more is needed. So make an appeal to whoever it is, and hopefully we can get some more people to assist you.
Thank you. Thanks for this opportunity, and thanks to all people who have contributed in many ways to the health sector in general, but Tamale Hospital in particular. One of the issues is that Tamale Hospital is taking care of patients from all the northern part of the country. And considering that there's no regional hospital in Tamale or northern region for that matter, we are also serving as a regional hospital. And our outreach services that I talked about, we are able to reach a lot of people directly in their communities. And so we are appealing to banks and other financial organizations, to the press and anyone who can even join us and be able to send the information across that these kind of services are available. I wouldn't want to just, pick on a few people, but indeed I would like to thank, all those who have contributed in many, many ways towards getting our outreach programs. But invite also the district assemblies to take advantage of this, our initiative of mobile clinic services, and send us to the most remote areas where we don't have hospitals and clinics, so that we can offer direct services. And to thank TV3 for giving us at least a lot of coverage in the recent times, and helping our patients to get better.
You're most welcome, sir. You're most welcome. So if you do have any donations or any contributions that you want to put towards the Tamale Teaching Hospital, you can obviously contact them directly to do so, or contact anybody here at TV3, and we'll make sure that those donations get sent there directly as well. So once again, I want to say a big thank you to Dr. Akis Afoku. He is the Director of Medical Affairs. He's also the Coordinator of Mobile Clinic Services. He is a Chief Lecturer and also a urologist, all at the Tamale Teaching Hospital. Thank you so much for coming in this morning.